Hello, welcome back to Into Deep, a podcast with me, Alyssa. In this podcast, we go a little too deep into everything feminism, from reproductive health to why do men keep wanting to date women who are like 15 years younger than them. Yes, in this episode, we're talking about, if you read the title, actually you would know what we were talking about already. But before we get into that, you might be able to hear a lot of background noise. The reason for that is that my laptop is about to explode. Like, this is the loudest noise my laptop has ever made. So, and it's also like 38 degrees. So, there's a fan sound as well. There's just everything happening at the moment. And there's nothing I can do about that. So just deal with it. Also, this video will be going up on International Women's Day. Happy International Women's Day. It's also WA State Election Day. And you know what's really great about that falling on International Women's Day is that there's actually no women in my, what's called like division. There's no women running. And let me just give you like a scope of the kind of parties I have the ability to vote for in my like state electorate. Is that what they're called? I actually don't know. So we've got the Greens, thank God, because if we didn't, there actually wouldn't be anything else. Labour, Liberal, of course. And everything else is just the worst party you've ever heard of. Shooters and Fishers, the like Christian party. And I think there's a One Nation candidate as well. So who am I supposed to vote for? I think there's actually a legalized cannabis party as well. But like, I don't really want to vote for someone to legalize cannabis if it's a man. Sorry. And there's no women candidates in my division. So who do they want me to vote for? Not even any independents. Like, they're all just like freak hunting parties and Christians. Can we like, I mean, I'm not going to dox myself, but like, can we get some more normal people in my electorate, please? Even for the federal election, I have 3 possible candidates and they're Labour, Liberal, and Nationals. I don't want to vote for any of those people. It's dire. And particularly on International Women's Day, I can only vote for men, okay? I'm moving house, question mark. Anyway, let's get into the actual important part of this episode. We're going to be talking about, I guess, actually what inspired this mostly was I'd seen a lot of TikToks about marijuana usage in men and how that could lead to miscarriage or spontaneous abortion for the woman that they impregnate. This was based on an article published in 2021 by Alyssa F. Harlow et al., Male Preconception, Marijuana Use and Spontaneous Abortion, a prospective cohort study published in Epidemiology. This article recognized how marijuana use has increased over the last decade, and especially with the legalization in a lot of, actually I think like 10 US states it's legal now. However, I mean, there's not been actually that much study into the effects, I feel like, and particularly on the risk of spontaneous abortion, but also other birth defects. And I think that's something that runs true for a lot of things regarding men, especially. I mean, like, I feel like it's pretty obvious that a woman shouldn't smoke weed while she's pregnant, but even in preconception, that's important too. So this study analyzed data from Pregnancy Study Online, which is a North American prospective cohort study of pregnancy planners from 2013 to 2019. During the preconception period, participants complete like baseline questions on demographics, medical history, and behavioral factors, including marijuana use. Female participants also identified pregnancy losses on bi-monthly follow-up questionnaires and also questionnaires during the early part of pregnancy and the later part as well. Among the 1,500 around that couples who conceived during follow-up, 9% of men reported preconception marijuana use of more than once per week and 8% at less than once per week. 19% of pregnancies ended in spontaneous abortion. The part of weed that is potentially damaging is the THC, or tetrahydrocannabinol, an exogenous cannabinoid. It's the primary psychoactive component in marijuana, obviously. Exogenous cannabinoids bind to cannabinoid receptors, which are present in human and animal testicular tissue and in spermatozoa. Male exposure to exogenous cannabinoids may disrupt the endocannabinoid system, adversely affecting semen quality and the integrity of sperm DNA as well. So obviously, if you're having like an exogenous cannabinoid that is affecting the sperm quality, it can also lead to DNA fragmentation as well, and that is associated with spontaneous abortion in some studies. Compared with no marijuana use in this study, there was an increased risk of spontaneous abortion. And I feel like that is something that a lot of people don't think about when you're talking about like birth defects and miscarriage and things. I mean, obviously an important part of this episode, we're going to be talking about how it is typically blamed on women, infertility and birth defects and miscarriages, when it can actually be the fault of both people involved. And particularly in like the preconception stage, there's so many things that women are told to avoid, whereas that same focus isn't put onto men. And then women are the ones that are blamed for things like miscarriage. It's like, potentially someone else is at fault here. The article also identified the fact that to date, most research has focused on female risk factors for spontaneous abortion, as I said, which is funny considering the lack of research into women's health overall, except when we're talking about her ability to produce a child. The gendered basis in research is like so anti-women. Anything like endometriosis, any other issues surrounding periods, like PMDD, so under-researched. But when she has to have a child, it's to the point where it's over-researched for women in terms of risk factors for spontaneous abortion or risk factors for birth defects. It is so focused on women when obviously men can have an impact on these things as well. There's a lack of research for men in this case, which is crazy. Actually, a lack of research for men. Astonishing. It also mentions a few other studies that have explored the association between male preconception, caffeine consumption, alcohol use, and cigarette smoking, and spontaneous abortion, all of which have some studies which point to intake of any three substances having an increased risk of negative pregnancy outcomes, but it's also inconsistent, and some studies show like no effect. So I think, especially when you take that into account, it looks like it's so under-researched because there's just no clear consensus about whether these actually do have negative impacts or not. But then there's so many studies that do show that there's a higher risk of negative impacts on pregnancy as well. So it's like, there's just not enough research into the potential effects. Anyway, that article is what inspired this episode initially. But then as I was looking into it, I was thinking like something that is so common is blaming women for so many issues when it comes to pregnancy and birth defects, and the historical blaming of any issues in pregnancy on women. And I think even though this is like pre-medicine, pre-research, historical, where women's only role was to like produce a child, and if they were unable to do that, it just kind of like fell onto the woman for being defective. But yeah, such an ignorance to whatever men doing having no impact is just so like so backwards, especially considering these days there actually is research to show that there are definitely potential negative impacts based on like what a man does pre-conception. And I just think like ignoring that is so like, it feels like you're being stuck in some historical bias as well. So I found a Vice article titled "People Always Assume Infertility is the Woman's Fault." This author is talking about her experience during pregnancy particularly, and how she was struggling to conceive, but they never, or at least not for like a long period of time, did they even think to test her husband to see if he was the one who was infertile. So she had to have a HSG or hysterosalpingogram. That is a crazy title. Conducted in order to determine whether her fallopian tubes were blocked. This is a common test performed on women who are trying to figure out why they are infertile or can't conceive. All she remembers from that procedure, she says, is pain. They told her it would feel like menstrual cramps, but it was so much worse. It was only 5 minutes, but it was like one of the most painful things she's ever had to experience. And as her test came back clear, again, she had no issues. She was like thinking to herself, why can't I get pregnant? Like, what's wrong with me? Why am I defective? And why am I infertile? For years, she'd been spending money on like tracking ovulation, gone off antidepressants, like fertility friendly, everything, had consistent blood work done, fertility medication injected every day, ultrasounds to monitor her ovaries. Meanwhile, her husband didn't even have his semen analyzed until after she had undergone the painful HSG. Women already obviously bear all of the burden for preventing pregnancy. Not even to mention like the cultural and historical pressures of being labeled a whore, or the many stories from the 1900s of young women getting pregnant out of wedlock and being forced to give up their children even if they didn't want to. And then nowadays, obviously, again, all of the blame seems to fall on a woman if she falls pregnant, when typically it's like never her fault. Like realistically, whose fault is that? And then if we're talking about receiving hormonal birth control, for example, it costs money to make the appointment, it costs money to get the prescription and then to upkeep that every single day, and then having to go back and get another prescription filled every 3 or 4 months. And I just started birth control myself to see if it would help with PMS symptoms, because my symptoms get so bad they're like bordering on PMDD, which if you haven't heard of PMDD, it's just like extremist PMS symptoms. It stands for premenstrual dysphoric disorder, which makes so much sense because you literally feel like you're going crazy. Like it's like dysphoric in the sense that you're just like not yourself at all. And it also comes with other symptoms like suicidal ideation, like depression symptoms, and something like that is so extreme. And again, I don't know if there's research into this, but the emotional impact that PMS has on me, and I don't even have it as bad as some other women do. Like the amount of women that must have killed themselves while PMSing, and I'm like not even kidding, because for me as well, it gets to the point where it's like suicidal ideation, and I didn't even have it that bad. And PMDD is something that is so insanely under-researched as well. Anyway, for me, it got to the point where I had to go home from work one day because I literally felt like I was dying, not even just physically, but also emotionally as well. Like I couldn't even talk to people. Like I thought I was going crazy. And mentally as well, I was just like, yeah, just like dysphoric essentially. And then I went to the doctor to ask her about it. And I was like, I think I'll just try birth control because typically that gets rid of PMS symptoms. And then I was like, oh, but I don't really know like what, oh, this was crazy as well. I was like, I don't really know what other options there are. And I meant other options for like dealing with PMS. And then she just started listing every different type of contraceptive. I was like, I'm not here for a contraceptive. Like that. She was like, you can get the implant, like an IUD. I was like, I don't want either of those because it's not for contraception. That's not why I want it. Like, I wanted to deal with a mood disorder essentially. And typically the other thing that they would give you for PMDD would be like SSRIs. And one of my friends in pharmacy as well was like, realistically what would help the most is cyclical SSRIs, like antidepressants that run on a cyclical basis. So you don't have to like change all of your hormones under birth control to get rid of it, because that just shouldn't be necessary. But cyclical SSRIs are not a thing, I don't think. I haven't researched this, so actually maybe like don't take my word for it. But yeah, there's just no actual treatment that is specifically for a lot of these things that come with any issues that arise from like your menstruation cycle. And they just like, I feel like birth control as well is so overprescribed. has so many possible negative impacts as well. I only started it like 2 or 3 weeks ago. I was so nauseous and sick for like 2 weeks, and I'm still unsure if it's even helping with the initial problem that I wanted it to help with. So, like, I don't even know if it's going to help. And then you just have to be on this like hormonal suppressant essentially for like 3 months to even figure out if it's doing what you want it to do. And then if it's not, you have to switch to another one. And then if that doesn't work, you have to switch to another one. It's like, okay, why can't there just be something that I can take for PMS symptoms? Why do I have to be on birth control? Because I feel like that's doing a lot more than I need it to do. And also the side effects are just like potentially so crazy. And I mean, I think there are potentially other things you could get like prescribed for, but you'd have to spend so much money going to specialists, and you have to track it every month. And I think to actually be diagnosed, it has to be something that you're dealing with like consistently every month, whereas for me, it's not that consistent. And so like visiting specialists and psychologists and everything and OBGYNs, it just seems like such a waste of money if in the end it just like you don't even get prescribed with anything different. And actually, again, I'm lucky to live in Australia. My birth control only cost $20 for 4 months. If I was American, how are they affording that? I mean, I know like most Americans have health insurance through work, but I've also heard their prescription system is really bad as well. Like you can only go to specific pharmacists to get your prescriptions and things like that. Yeah, I don't understand their entire healthcare system. But anyway, my point is a lot of other people don't have the luxury of healthcare that we have in Australia, even though it's going downhill. But as of right now, I'm okay with $20 for 4 months. That's not that bad. The problem is, like, yes, the burden also lies with women to not get pregnant, but it also lies with women to become pregnant as well. Oftentimes, they're forced to have invasive, painful tests, like the author of this article. Meanwhile, their male partner is, like, never even checked. And this isn't just because of a gender bias against women in research. It's also the obsession with masculinity and having, like, powerful sperm. Like... Men don't want their semen analysed for the fear that their infertility will somehow reflect on their masculinity, which I simply can't have any empathy for, because while your wife is having all of these like extremely invasive, painful tests, having dye injected into her fallopian tubes to check if they're blocked or not, and you're like, no, I don't want to get it tested because what if I'm not a real man? Who cares? Say it with me, guys. Masculinity and femininity are made up. Even if they weren't, why is how good quality your sperm is, why does that affect on you being a man? Like, that to me is so like Viking. You know, we're not like pre-medicine. Like, we know why these things happen and how to fix them. It's not some like higher power who's punishing you for not being male enough and that's why you're infertile. Like, anyway, the stigma for that can be so strong that even if the woman knows that she's not the defective infertile one, she'll still take the blame for it, because men are too scared to be infertile. Anyway, the author of this article said after she switched to a new urologist, they learned that her husband's white blood cell count was really high after he had secretly been smoking. A habit which, of course, can adversely affect sperm production and sperm quality as well. So it turns out it was her husband's fault for their infertility, and he never got checked. And the reason he was potentially infertile was a reason that he literally knew about and just lied about for years while she went through all of these painful procedures and tests to check her infertility. Okay. And you know what's crazy about that? Not checking like both the woman and the man when they like go to like fertility clinics. I found an article from Penn Medicine, like Pennsylvania Medicine, I think, in Lancaster General Health, titled, "Did you know infertility affects men and women equally?" This article is by Christine Kaliskiadis, MD. A third of infertility comes from women, a third of infertility comes from men, and then the remaining cases are a mix of issues and circumstances which are not well understood. So what I'm hearing is men and women are equally infertile. So why is it that when a couple goes to a fertility clinic, their first thing to do is check only the woman's fertility levels? Misogyny, maybe? For women, their infertility can include problems with ovulation, damaged or blocked fallopian tubes, advanced maternal age, and other issues like prior infections or surgeries. For men, I don't know how to pronounce this, varicocele, aka an abnormal dilation of veins within the scrotum, obstruction, medications, hormone abnormalities, and ejaculation problems. So overall, though, the percentage of male and female infertility, which leads to problems conceiving, is the same. But why is it that we always check the woman first? So I found another article, I don't think it's been published yet, but it was on early access, in Andrology by Lena Vignozzi, titled "Why Couple Infertility is Historically a Female-Driven Problem." This paper aimed to kind of delve into the historical roots of the aspect of gender inequality related to couple infertility. And I think that's really important to do because as we've seen, I feel like men especially are so trapped in thinking that just because something is the way it was in history and culturally and religiously, then that's the way that it should remain forever. Like, yeah, when we didn't know what gametes were, they're the people in history we're going to listen to about reproductive health. Make that make sense. Despite the increasing evidence of a male factor as the unique or coexisting cause of couple infertility in almost 50% of cases, as I said, public opinion on infertility as a first-driven female problem has remained sharply unchanged over time. Very often, the male partner is referred to the andrologist only when no female causes for infertility emerge from the long, complex, and sometimes invasive workup on the woman. While modern science shows that male and female factors equally contribute to couple infertility, it is generally believed that most ancient civilizations attributed infertility to women. Not the ancient civilizations that we're listening to still to this day. So this short review reconstructs a complex network of cultural narratives, medical epistemologies, and gender normative references to highlight some moments in the history of the concept of infertility. A woman's central role in a lot of these ancient societies was determined by her ability to procreate. Like, that's all women were, which isn't really surprising. But up to the medicalization of infertility, that was it was always assumed to be the woman's fault because I guess they didn't know how fertility even worked back then. To sum it up, throughout different historical periods, these were the main approaches to male infertility. In the classical antiquity period, it was attributed to something outside of human control that depends merely on the constitution of the body or on lifestyle factors that could lead to the loss of reproductive ability in men, generally untreatable. Also, an incompatibility of the couple was possible, or a possible reason as well. In the Roman world, fertility was considered as a central point in the life of the couple. The couple's infertility responsibility was often attributed to the woman again. During the Middle Ages, it ranged from an extremely religious view of infertility as a curse from God or the work of the devil to the rational medical conception of it as a kind of disease to be cured. During the modern period, of course, nowadays, men are usually not contemplated in the medical discussion about infertility due to the patriarchal, misogynistic, and gendered assumptions of early modern society, despite spermatozoa discovery and male consumption of drugs against infertility. As I've already said, I feel like as someone in Australia who's obviously quite well off, not because just of our healthcare system, but also the societal expectations I I mean, okay, it would be a lie to say that like I've never felt like in my life there's been some sort of pressure on me to have children, but typically that's only when like I'm arguing with men, which also doesn't happen very often because what man is like, nah, you need to have children? Like that doesn't really happen. The last time I was talking to a man who said that they like, it's more so like I feel like they don't believe you when you say that you don't want to have children. The last time that happened to me, I was talking to two American men. Like I genuinely don't think that like Australian men would say that. Or at least the ones that I communicate with, I don't think they would be like, no, you're lying, you're gonna have children. But that has happened to me before. But that's really the only instance of like someone not believing that I don't want to have them myself. But there isn't like a societal pressure to have children or be like ostracized. And it's also not my role in society. Like I'm not like as a woman, I don't feel pressure to have a child. And if I did want to have a child, I don't think there would be as much pressure or like blame put on you if you were infertile as a lot of other countries. And as well, infertility, if you're infertile in Australia, there's a lot of access to healthcare to help with fertility as well. So there's a case study that I found, an article published in Reproductive Health by Zubia Momtaz, titled Understanding the Impact of Gendered Roles on the Experience of Infertility Amongst Men and Women in Punjab. Infertility is a global challenge, but low-income countries have particularly high rates of up to 30%, despite their high fertility rates. Let me explain that a bit. Infertility rates range from 22% in South Asian countries to 29% in some sub-Saharan countries. In this sense, infertility rate is someone who is like clinically infertile. However, the fertility rate is the amount of people who have children, right? So in a lot of these countries, they have a really high fertility rate because most people who have children will have a large amount of children. But because of a lot of other issues that are typically medical issues, but there's a lot of problems that I will get into as well, they do cause a high infertility rate, which is the more clinical definition. If you want to hear more about a country with a really low fertility rate, which is not necessarily that anyone is more infertile than in other countries, listen to episode 3, where we talk about South Korea and its extremely low fertility rate. And in that country, it's typically based on economical, societal, and other issues that are happening there as well. It's not because of infertility. This article is essentially a case study of how gender impacts infertility in Pakistan. So it uses two types of infertility, or two categories of infertility, I guess, primary and secondary. Primary are the more anatomical, genetic, endocrinological, and immunological problems which cause infertility, which is, I guess, what most people would think of when you think of the clinical definition of infertility, and particularly in first world countries, that is like one of the like more common reasons why someone will be infertile. The secondary reasons for infertility are things like STIs or like post-STI sequelae as well, which cause infertility, poor healthcare, exposure to toxic substances, sociocultural practices like marriage between relatives, especially first and second cousins, and female genital mutilation, which these secondary causes of infertility are the majority reason for childlessness, particularly in low-income countries. So the aim of this study was to explore and compare how gender ideologies, values, and expectations shape women's and men's experiences with infertility in Pakistan. In a highly pro-natalistic and patriarchal society like Pakistan, women bear the brunt of social, emotional, and physical consequences of childlessness. While in higher income countries like Australia, the US, European countries as well, women will still be blamed for infertility, or if you want to get your fertility checked as a couple, it'll typically be the woman that they check first. In countries like Pakistan, where to this day a woman's only role is to be a wife and a mother, to fail at one of those things is like unthinkable. In Pakistan and other similar countries, the current gender ideology is largely centered on a patriarchal interpretation of Islam. Men are considered inherently superior to women as they possess qualities like dominance and authority. Women are deemed both emotionally and physically unstable, and the only kind of education necessary for women in these countries is to become a good wife, mother, and homemaker. This gender order is presented in the society as divine and natural. Family formation in these countries is patrilineal, and families are most often marriages of first and second cousins. Families are also extremely hierarchical. Once a bride moves into her new marital family's home, she is subordinate to any of the men in the household and also the senior women as well. Preferably in her first year of marriage, she should have a child, and it's expected for a woman to produce at least one son to continue on the patriline. I think 4 children is the most common, and they would typically want 2 of those children at least to be boys. Because of the value and the role of reproduction in a patrilineal society like Pakistan, failure to have children is unacceptable and has disastrous social consequences for women. Women have reported psychosocial consequences to be depression, unhappiness, dejection, and suicidal ideation. For women in low-income countries, motherhood is not only a source of status and power, it is also the only avenue for a woman to ensure marital security. In countries like this, without children, there's no reason for the marriage to be together, kind of. And without marital security in that sense, like, there's no safety that typically would come with being in a marriage, like safety as in society, like social safety. Women also face harsher psychological, social, emotional, and physical consequences of childlessness than men. They experience abuse, exclusion, and stigmatization by both their husbands and at a societal level. For example, there's been some anecdotal evidence of women who are infertile, not being allowed near other children or not being allowed to touch other children because there's some idea that they're going to pass on their evil infertility to this child who's then going to have negative impacts from being around an infertile woman. Women are blamed for childlessness regardless of which partner is clinically infertile, and even if they know that the infertile partner is the man, regardless, people will still blame the woman. And there's also regardless of the current knowledge that infertility places men as equal contributors to not having a child. In a lot of these areas as well, there's been a really big bias in literature which only focuses on infertility in women. And of course, this is a problem globally, but especially in the global south in any of their literature. In India, for example, men reported that they were aware of the possibility of themselves being the defective partner, but were reluctant to undertake treatments for the fear of social disgrace. Men report things like stigmatization, verbal abuse, emasculation, and loss of social status, which again, the impacts for men are minuscule compared to how women are treated for infertility. So even if you know that the man is infertile, the woman will still take the brunt of it because people just assume that it's the woman's fault. The impacts for men are so much less severe, and they tend to just be about a bruised ego and social expectations and social status, whereas women are expected to deal with domestic abuse, and especially for something that might be completely out of their control. There's a quote from a 24-year-old childless man. He says, "We don't have anything between us to stop us from leaving each other. If we had a child and my wife did not like me, or if I did not like her, we could not just leave each other because there would be a tie or bond between us to stop us. That is why children are important in marriage." So as I said, the marital security thing, in countries like this, marriage really depends on children because that is the most important part about marriage. And without children in a marriage, then the marriage is pointless. Another 29-year-old childless woman said, "Sometimes my in-laws used to beat me, kick me out of the house, and send me to my parents' home just because I could not give them a child. I was treated like a servant. I had no rights in the house." So typically when a woman is infertile as well and can't produce children, she's kind of then just treated like a slave in the house, because as a woman, if she can't fulfill her role as a reproductive entity, then her only other abilities in the household are to be like a homemaker, so cleaning, cooking, things like that. And it's just like she's just essentially, she would be the lowest status hierarchically in the house and would just be treated like a slave, essentially. There's also one of the main hypocrisies surrounding infertility, especially in, actually globally, I would say, but particularly one of the things you see online so much are women being blamed for waiting too long to have children. And I think this is such a huge hypocrisy surrounding infertility, for like berating women for waiting too long to have children or waiting too long to find a partner. Like how many tweets I've seen from men being like, oh, a woman's greatest fear is late marriage, or waiting too long and not finding someone until she's too old to have kids. Okay, it's well known for women that by age 30, fertility starts to decline. And particularly after 35, it starts to rapidly decline. For some reason, men think that's a reason to date like 18-year-old girls, which, okay, I don't think that doesn't make any sense, because you can still choose to date a woman under 30 if you're really worried about fertility. She does not have to be 18. And what's also funny is that fertility in men also declines with age. After around 40, it starts to decline very like rapidly, fertility in men. Also, my mum had me at 37 and I'm fine. So therefore women can have children at any age and it's fine. If men want to say that, like, you know, taking too long, not that I like believe in this, but taking too long to get your life together, get married and have kids is somehow the woman's fault if she's then struggling to conceive, then let's talk about the impacts of paternal age on birth defects, since men love to date women who are like 30 years younger than them and then are like, well, I'm only dating her because any woman older than that won't be able to give me children. Okay. Infertility based on age is not just a woman problem. A lot of this information I've taken from The Guardian, an article titled "The Perils of Putting Off Fatherhood, Why It Poses Risks to Children's Physical and Mental Health," and also an article published in a journal titled Aging in 2020 titled "The Effect of Paternal Age on Offspring, Birth Defects, a Systematic Review and Meta-Analysis by a Group of Researchers from China." Regardless of the fact that thankfully, now there's substantial evidence that suggests delaying fatherhood can carry its own consequences, regardless of the fact that that never seems to be a focus. In England, the NHS does not offer IVF to women over 42, but there is no mention of paternal age in its recommendations, which is crazy because paternal age can very negatively affect the efficacy of IVF as well. The systematic review and meta-analysis that I mentioned was aimed at determining whether paternal age is a risk factor for birth defects. It found that paternal age is associated with a moderate increase in the incidence of urogenital and cardiovascular abnormalities, facial deformities, and chromosome disorders. This article was novel because it included many different articles in its analysis and sorted the potential birth defects by bodily system. So potential issues could include like cleft lip or a hole in the diaphragm. Certain cancers like childhood leukemia, brain cancer, and breast cancer are also elevated in people born to older fathers. Conceptions from older men are also more likely to end in miscarriage or stillbirth. There's also neurological effects, which are increased as well. Children with fathers over 40 are 6 times more likely to have autism than those with fathers under 30. Babies to fathers over 50 face up to a 5-fold increased risk of schizophrenia and other issues like OCD, ADHD, bipolar. They're all more likely as well. So I find it very hypocritical to blame women for waiting too long and then struggling to conceive when men who are older and are choosing to still have children have such an increased risk of so many potential birth defects and also spontaneous abortion as well during pregnancy. Like, is that not a little bit hypocritical? In the US and Europe, late marriage and childbirth is increasing. And so the birth rate among older fathers is also increasing. In the US, for example, in 1980, 43 babies were born each year to every 1,000 men aged between 35 to 39. This jumped to about 70 in 2015 and is steadily increasing as well. Age affects sperm itself, negatively affecting quality, how it looks, movement, and quantity. Damaged sperm is like less likely to be able to fertilize in the first place, but then it's also having an increased risk of birth defects or problems during pregnancy as well. In a study of 2,100 UK couples, men over 45 were nearly 5 times more likely to take more than a year to conceive compared with men aged under 25. And this held true even when their female partner was young. So all these 50-year-old men dating younger women being like, yeah, because I want to make sure I can have children. You're too old already. Sorry, you're too old. Maybe you shouldn't have taken too long to find a partner. Yeah, maybe you should have had your life together before you were like 50 and then you decide that you want to have children. Okay, well, now they're all going to have birth defects. So, like, blaming women for this sort of thing is just so hypocritical when age in having children is a problem with both the mother and the father. Like, so many older men continue to look for young partners to ensure that she's fertile, but that just doesn't help when you're already an old man. Robert De Niro, for an example, having his 7th child at age 79, and it all seems like perfectly fine because his partner is younger, so like she's going to have less issues during pregnancy, statistically. But the potential issues that can have for the offspring is severely elevated, and I feel like that's, especially when you're 79, like that's a bit selfish, because thinking about the potential issues that can have for your child, and then you're 79, you want to have your 7th child, like, I feel like that is for very selfish reasons. Elon Musk as well, I think he just had his 8th child. Potentially he's also impregnated like another woman as well. You're too old. You're literally 53, like stop having children. Like they're all gonna have probably issues as a result of you just being selfish and continuing to have children at that age. Also, he has some like weird thing about like wanting to populate the world with his DNA or something. So even if he wasn't old, I don't think he should be having children, but I digress. Why exactly does men's reproductive capability decline over time? If they are technically able to reproduce pretty much their entire lives, let's get a little bit sciencey. I'm kind of excited because we haven't really talked about science yet on this podcast, and a lot of the stuff I learned in university, so yeah, I don't even need references. Just kidding, I'm using references. It's, again, well known that a woman is born with all the eggs she'll ever have, and then over time you lose them and then they aren't the same quality. Men need to continuously replenish spermatogonial cells, stem cells in the testes through cell division. If you're listening and you know anything about basic cell division and DNA replication, it won't be surprising that after replicating the same cell for a man's entire life, there might be a few issues in the genome. There might be a few mutations. That's not surprising. Replication involves copying the entire genome, which is about 3 billion nitrogenous bases long, if you don't know how DNA works. It's just essentially letters coding a long code of 4 different letters. So the genome is about 3 billion bases long. Though it's extremely rare, sometimes a copying error is made, and then that stem cell will forever carry that mutation. That doesn't necessarily mean that there's going to be like a mutation or a birth defect immediately in the child. It's been estimated that the sperm produced by a 45-year-old will have had 750 replications, and each replication creates or allows for more opportunity for a mutation or a mistake in the genome. Over a longer period, genetic mutations could also be caused by other external mutagens as well. Anything is potential, like UV damage can cause a change in the genome, and that's why it causes skin cancer, for example. But there's so many different things which can cause damage, even like smoking or too much alcohol consumption. There's so many different mutagens which can cause damage, which overall means children of older men are more likely to have more genetic mutations in their genome. And if we're talking about a 45-year-old already having 750 replications, imagine Robert De Niro at 79. He would have like somewhere around like 1,500 replications of the same genome over and over and over again. The amount of mutations that he would have, or I mean, to be fair, he could have zero. Like he could have the most perfect replication technology ever that's never made a mistake. But statistically, it's just a higher chance. About 80% of de novo mutations in children come from the father. Most children are born with like some degree, like a few mutations. That's normal. But as the father gets older, any of like the new mutations come from the father, about 80%, as I said. Whether younger or older, that's just where the mutations come from. Though, of course, most of these will have no effect, as I said, as either they can be silent mutations, like they can mutate in the DNA, and then like if they're in a coding region of the DNA, they can mutate in a way where it still produces the same protein, and therefore it doesn't have a real effect. Or the mutation can be in an area of the DNA which is not a coding region and is therefore not expressed. Regardless, they are still important contributors to genetic disease and affect about 1 in every 300 live births. A small subset of disorders have been called paternal age disorders, including achondroplasia, which causes dwarfism, and Apert syndrome, which leads to a misshapen skull and fused fingers and toes. And they are typically caused by genetic mutations. Epigenetics is potentially another important factor as well, although there isn't much research to back this up. It isn't just the sequence of DNA bases which is passed down, but also epigenetic factors too. Epigenetics refers to the study of like heritable traits which do not require changes in the DNA sequence. So they're not based on like actual genetic mutations, but rather chemical modifications added to both DNA and proteins, which effectively switch on or off certain parts of the DNA. And some forms of epigenetic changes are heritable as well. So if there's changes in the DNA, they can dictate which proteins will be produced in the same way that a genetic modification could as well, or a mutation. So what is passed down and how, and to the degree that there could be like damaged DNA passed down, it's a complex combination of stem cells acquiring new combinations, epigenetics, experiences in the man's life, including environmental exposures and other potential mutagens, and other things causing oxidative stress and damage. So overall, yes, paternal age does matter. You can't just be like 95 years old and still having children and expecting that there's not going to be any negative effect on the child, because men just produce sperm forever. So like it must be fine. Yeah, and I think that is something that is so focused on as well. Like there is just such a big focus on women having to like keep track of their biological clock before they run out of time to have kids. If you're doing other things with your life and you run out of time to have kids, then I guess you weren't supposed to have kids. Like it's just not that serious. But yeah, an old man chasing like an 18-year-old because he wants to still have children. You know what? I would argue it's probably not because he still wants to have children. It's more so that he's just like verging on pedophile. But okay. Anyway, my main point of this video was that putting so much of a burden of both making sure that you don't get pregnant and then making sure that you do get pregnant, and then infertility and fertility problems and all of the societal pressures that can come out of that, specifically in low-income countries for women. All of this is just based on something that is not scientifically backed up, and instead science says the opposite. Men and women are equally able to be infertile and equally able to contribute to a couple's inability to conceive. And so just such a large focus on women being the problem is just misogyny. and patriarchy as well, and toxic masculinity. So I hope you learned something new in this episode. We were really due for a science episode because I haven't done one yet, which was kind of sad. But also I got the video to work, which is, do you know how difficult this was for me? Like, literally nothing was working. Like, I spent hours. And the last video episode I did, the audio quality was like horrific. I think it should be fine in this one because my mic is actually working. But yeah, I think a few people liked the video episodes, so I will keep doing them, even though my laptop is about to blow up and my phone is about to die. It's okay. Thank you so much for listening. I will see you next Saturday. Have a good week. Goodbye.